Al, thank you. And this morning on Today's Health, your embarrassing questions answered. You know, some health concerns aren't that easy to bring up with your doctor, but getting answers now can prevent more serious problems down the road. So Dr. Keri Peterson is here. She's an internist and a contributor to Women's Health magazine. And Keri, we like to say your other qualification is you've seen and heard it all.
I have. Definitely what we're talking about today.
And our Today viewers actually sent in all of these questions. So bravo to the viewers. We're going to answer them anonymously. Fear not. The first question is, quote, I'm in my 40s and started getting canker sores 4 years ago, and they are really painful. Are they anything to worry about? And is there anything I can do about them? A lot of women suffer with this.
Canker sores, they are so painful. They're little ulcers on the inside of the mouth. I want to clarify that they are not the same thing as cold sores, so they're not caused by the herpes virus.
Okay.
But we do know that they're associated with a few factors. They may be associated with trauma in the mouth, so if you have brushed your teeth and you nicked your gum
or you bite your cheek,
it can turn into a canker sore. Also, if you have vitamin deficiencies of zinc, folate, B12, or iron, that may be associated with canker sores. Celiac sprue, which is a wheat gluten allergy, can be associated with it, as well as possibly your immune system may be a little faulty and attack your mouth and create these little sores.
So is there anything you can do about it? Are there any treatments for it, or are you just supposed to suffer?
Well, the majority of the time, they just go away on their own in about a week, and they're so painful, I recommend using a little bit of Anbesol just to ease it. But if they're these really big ones and they're lasting a really long time, there are prescription solutions you can use.
Okay, our next question is, I have pimple-like bumps on my buttocks and thighs. It's been going on for almost a year. What are they, and is there anything I can do to prevent them?
This is unfortunately really common, and people often think it's acne, but it's not acne. Most commonly, it's folliculitis. It's a mouthful, but that's an infection of the hair follicle. Oh. And it's caused by sweat being trapped in the pores of the hair follicle. Bacteria gets in there, and it creates these little pimples. So you'll typically see it in people in hot weather who are wearing snug clothing, or in people who sit all day, like drivers, for example.
Any treatment for it?
For this, you can use an antibacterial wash or a benzoyl peroxide wash, and it usually clears it right up.
Okay, our next question. What are the small, white, foul-smelling particles that appear on the back of my throat and cause bad breath, and how do I get rid of them?
Oh, this is something I see in my office all the time, actually.
Really?
Yes, so the tonsils are really filled with these nooks and crannies if you look in the mirror. And bacteria and mucus and dead cells can all collect in these little crannies and create this white, really foul-smelling material. And it can solidify and create tonsil stones. Oh. And you can get all sorts of symptoms from them. You can get sore throat, bad breath, difficulty swallowing, and it can swell up your tonsils. So people hate them when they have them.
So how do you address it?
Well, most commonly, people don't do anything. They just kind of swallow them eventually, but because they can smell really foul, you can use just a little Q-tip and kind of dislodge them, and it
really, and that's okay? Just like swab them,
you just pop it out. You can pop it out, and also if you use saltwater gargles or hydrate a lot, it can flush out the tonsils and prevent them from forming.
Okay, a lot of folks can relate to the next one. I have lots of skin tags under my arms and neck. What causes them, and how can I get rid of them for good?
Skin tags. People get worried because they think, is this skin cancer? And what it looks like is this fleshy little hanging mass. It's completely benign, and it happens in areas that rub together on the skin, so areas of friction. You'll see it in the armpits, you'll see it under the breast. It more commonly occurs in people who are overweight, pregnant, or diabetic, and they're nothing to worry about.
Nothing to worry about, but you maybe don't want them hanging there. So can you take that same swab and just take them right now?
No, you can't use the swab. You can't use the swab. But there's over-the-counter material you can put on them, and it sort of works like a wart remover. They just fall off. Or you can go to a dermatologist, and they can cauterize it or freeze it.
Okay, next question. I sometimes have blood in my stool. Is this something to worry about? This is one of those vague symptoms that can mean a lot of different things, right?
Yes, and patients who come to see me with it are often very alarmed by it. It can be very disturbing. Most commonly, if you see bright red blood, it really is nothing to worry about. It's typically from hemorrhoids or anal fissures, but it can be from polyps. So at Women's Health, we always recommend get it checked out just in case.
Okay, last one. We got to do it in 20 seconds. I have dark colored skin in my inner thighs, and it has a rough feel. What causes it? How do I get rid of it? Make it fast.
Dark velvety skin, it could be a sign of diabetes, so make sure that you get your sugar checked if you see it.
All right, Dr. Keri Peterson, thank you for answering our questions.
Thanks,
and if you at home have some more embarrassing health questions you want us to ask, go to today.com, send them in for Dr. Peterson. We will not reveal you, but we will answer your questions. So coming up next.